So people ask me all the time, what is Grindstone? What is Grindstone Medicine for Men? And it's hard to quantify. It's it's not a testosterone replacement clinic. It's not optimization. It's not functional medicine. I mean, it rhymes with them, but that really doesn't encompass what we do. And the one thing that I think sets us apart, and I've almost come to think of it as the product, is the 45 minutes that I spend with you. 15 minutes is the traditional doctor-patient encounter or provider. I have nothing against advanced practice providers, nurse practitioners, physician assistants, um, or physician associates. Um, but I think something was lost when we lost those 30 minutes. So 45 minutes kind of is the product. 45 minutes where you get the dedicated attention of a physician with 25 years experience, and someone decided that you were only worth 15 minutes, and that someone isn't in the room. And this isn't a gripe session, and this isn't a grievance, but it's just a fact that the patient and the doctor weren't the one that decided that you only deserve 15 minutes. And in 15 minutes, I've done it. I lived it for 15 years. My first business, Baughman Family Medicine, I had 15 minutes to figure out what was wrong with the person. And I'm embarrassed to admit that a lot of times, by the time I hit the 10-minute mark, I was already thinking about the next patient, making sure that I was getting out of that room on time. Because if I didn't, I made the next person wait. And to me, that was just disrespectful of their time. If a patient shows up late for my appointment, if they're more than 10 minutes late, I send them packing. So if I'm 5 minutes late with each patient, by the time I see my first 4 patients, I'm 20 minutes behind. And again, this is not me airing my grievances. This is just me saying I feel fortunate enough that I was lucky enough to get out of that situation where I only had 15 minutes for my patients. And I'm not saying there's anything necessarily wrong with it, but it's just not what we do here at Grindstone. I've had people come in, and again, in 15 minutes, it's like, what can I do for you? What's your chief complaint? And I take care of it. But what about the seizure medicine that you were put on, say, a year and a half ago, 2 years ago, 5 years ago? You had one epileptic seizure. You were put on a seizure medicine. Do you still need to be on that medication? Did we ever try a dose reduction? Or did we just put you on it and forget about it? And it's easier to let you take a medicine that isn't really harming you than risk having another seizure. But is that really the best choice? Anything that does something for you does something to you. And again, those are questions that you really you can't ask in 15 minutes. That opens up a whole conversation that you just can't explore in 15 minutes, especially if the person's coming in because they dinged up their elbow, or they sliced open their hand, or they've got an infection in their cuticle. This video is running longer than I intended it to, and but again, I'm just trying to bring some coherence to what Grindstone's about, what we do. And again, I really feel like 45 minutes is the product. 45 minutes of undivided attention from a person who has a lifetime of solving problems. My whole life, I've been a problem solver, a systems thinker, and a problem solver. And uh, if that sounds like something you're interested in, I'm here. And if not, we explore a lot of different medical conditions and ways of thinking and approaches to problems that again I see every day. So if you're interested, check it out. If not, I wish you well.